And this is Dr. Sandra Valiente, and this is the project I'm going to present, introduce to you. It is named Nutrisimile. Nutrisimile is a project that is going to and has been developed on the community of El Tanque, Antiguo, Cuscatlan, La Libertad, San Salvador, El Salvador, that was done on March through December of 1999, which its main purpose is being to provide feeding to children under 12 years old who had presented a level of undernutrition and desnutrition. First of all, we initiated with a situational diagnosis at El Tanque community, and this being done because I was working as a physician in primary care attention, practicing my social year at Emiliani Clinic, which is being just in front of Guadalupe Basilic, and adjacent to this basilic is the Tanque community. So we were trying to find screening for children under 12 years old who has presented a kind of level of desnutrition. Happily, we did not find any patient with kwashiorkor marasmo, and we made a diagnosis and we made a plan for treatment for these children, and a plan that you will follow on the slides. This slide, we can appreciate that 52% of children were girls and 48% were boys under 12 years old. Level 1, grade 1, or desnutrition, undernutrition was found on babies under 1 year. Hopefully, there were not too many babies under 1 year. These babies were restored its normal weight for his age with breastfeeding. That was very quick. There were not too many of this population we faced, but we found some babies that were undernutrition, were level 1. Yes, the children between 1 year and 5 years old were found, like 85 to 90% of them were grade 1 undernutrition. And also we found with physical signs of undernutrition grade 2 children between 1 year and 5 years old. So we did not expect to find kwashiorkor marasmo or grade 3 undernutrition, but the majority of the population of children in this community were between 1 and 5 years old. I also found children between 5 and 12 years old with certain grade of desnutrition, grade 1 and grade 2, relatively less than the children of 1 to 5 years old, but they still have physical signs of undernutrition. Some parameters we consider to diagnose, to classify these children were tricipital, and texture of skin, weight, and height. Between the children between 1 and 5 years old, we use just the weight in relation with its age to determine if they are undernutrition. Also, with children 5 to 12 years old, we measure and we make a relation between weight and height to determine if they are undernutrition. And this relation gives us an idea of their grade of undernutrition. There are other physical signs that we did not find, like edema, omega sign, fascias that were compromising their nutrition. Well, these are the results by month. We approach it to the community every single Saturday, and through March through December of 1999, we were having results, very, very, very happy results, and we see that most of the children between 1 and 5 years, they were restoring its weight very quick. They were the more stimulated community that restored their weight by its age. And the lazy ones were the children between 5 and 12 years. And as I said before, breastfeeding for children under 1 year, and they are relatively get their weight in 40%, 50% for their age. And this is the way we did it. We started by make a plan, to make a feeding plan for 12 months, and to restore their proteic and caloric requirements for these children with Cuscatlan milk, soya meat or soya flour, juices of different flavors, vitamins in form of syrup, recommendations of breastfeeding to ladies that have babies. And we can see here that we approach to El Tanque community every Saturday morning from 9 to 12, and with the help of Emiliani students, scouts, squads, they help us to provide children with their feeding every week. As was my initiative to introduce this project in this department of El Salvador, I designed a chart just to control during Monday through Friday the patients to come to the clinic and have their respective medical control. We give them a chart to get them knowledge that they were increasing its weight, or how they were improving its height. You can see children here receiving their soya flour, Cuscatlan milk, and I'm here with a couple of children over here. We can see that we were very happy, and we appreciate the cooperation of secretaries at Emiliani and Antiguo Cuscatlan Clinic.